This is going to be a guided yoga practice for sciatica and low back pain. I'm Dr. Anthony Davis, and in clinic, we have people coming in with low back pain, with radiating pain down the leg quite often. I have many videos that describe the anatomy of sciatica and videos that talk about things in yoga that maybe you should steer away from if you have sciatica, things that are just going to irritate the sciatic nerve. So this practice is aimed at accomplishing a couple of things. One, sometimes sciatica is not really coming from tight muscles, it's coming from the spine. So we want to have some good spinal mobility to nourish and hydrate the spinal discs in case they happen to be irritating that sciatic nerve, or really, at that point, the nerve roots before they even become the sciatic nerve. The other reason that sciatica can happen is that we have tightness in the piriformis muscle. Really, we would call that piriformis syndrome. The piriformis muscle is just underneath your butt cheek. It's a tiny muscle, but it's underneath all that stuff, and the sciatic nerve just goes right next to or sometimes through it. So we want to loosen up that muscle if it's tight, if it's entrapping the sciatic nerve. So this movement practice, I will use a lacrosse ball or a tennis ball or a massage ball. So pause the video if you need to go get some kind of ball, because we're going to sit on it to massage that piriformis muscle. You could use a baseball, I suppose, or a softball, maybe even a wiffle ball, anything that you've got lying around the house that you can use to get some deep pressure underneath that glute. So I'm going to set that off to the side. We will begin in a cat-cow kind of position, so tabletop on the mat. And the first thing that we want to do with low back pain and sciatica is that we want to have some movement in the spine. But many of you will have pain if you move into a rounded position. So we're exploring some cat-cows. So you can just begin at your own pace, where we arch the spine, look up to the sky. Imagine that you're trying to collect rainwater in your lower back. And then do the opposite. Round your spine like a turtle. Now, this sometimes hurts people's spines, their low back, and increases the radiating pain down the leg. So in either direction, I want you moving as far as you can comfortably, even if that's only a little bit of movement. So it can just be tiny little movements as you have more sensitive tissues in your low back, but I want you to gradually get used to moving your spine more and more. So you'll breathe in when you look up, and then exhale as you look down. Let's just keep this going. So inhale as you look up, and exhale as you look down. And we are going to do this a few more times. Inhale up. Nice and slow. And if you notice any guarding or bracing, fear or apprehension at bending your spine, please try to soften around that and know that this is a safe movement. And even if you push into a slight amount of pain or discomfort, that is safe. You are not going to injure your spine here. This is safe. Okay. Now, let's begin doing some rock backs into child's pose. So you'll begin in this tabletop position, inhale, and then when you exhale, you'll press your hips back towards your heels. And maybe you can get your butt all the way back to the heels. Maybe not. Maybe that hurts your back. So maybe you only go halfway, and then you inhale and come forward. And then we explore that. And maybe after you do this a few times, you can go a little further with less discomfort. We're just trying to loosen up the spine here. So exhale as you sit back. If you can get all the way back, maybe touch your forehead to the ground, and then inhale as you come forward. So we're just breathing and moving. We're just exploring. We're not forcing anything, but we're also not avoiding anything. So loosening up the spine, breathe through your nose. 2 more times, breathe in when you go forward, and breathe out when you go back. Okay, now I want to find our way up onto our knees. So we're just going to sit up here, and then all we're doing is taking the hands to the hips, and let's go side to side. So we just go one side, and then we go the other side. And you might find that when you send your hips off to one side, it kind of hurts. And maybe the other side, maybe that feels better. If so, I want you to really lean into the side that feels better, but don't avoid the side that's a little tender. I want you to still do what you can on that side. Maybe it's a little less movement, but do what you can. So we're just exploring some side to side movement. And now let's try the other direction, forward and back. So we've already done backwards. So now I really want you to send your hips forward and lean back a little bit, and then come back to neutral. So it's kind of like we're setting up for this camel position in yoga, but we're not quite going all the way back. We're just sending the hips forward and then relaxing. Send the hips forward and then relax. So just a few repetitions here, hips forward, shoulders back, and relax. We're going to do this about 5 more times. So hips forward and back. Here we go. And back. Inhale as you send the hips forward, and exhale. Inhale as you lift the heart, send the hips forward and back. A few more times here. Inhale. And back. A couple more times. And back. Forward. And back. Okay. Now, let's make our way onto our butts with our feet pointing forward. I just said feet, like plural, but double plural with an S for some reason. Let's just roll with it. So the sciatic nerve in yoga, a lot of times what we do is we try to reach forward, we try to grab our toe and pull our toe towards us as we're folding forward and tucking our chin towards our knee. That is a maximal stretch for your brain, spinal cord, and sciatic nerve all the way into your toe. And it's kind of irritating for the sciatic nerve. So the way that we do things classically in yoga doesn't really make a lot of sense. It's actually a sciatic nerve tensioner rather than a hamstring stretch. But of course, you feel a really intense stretch when you do that because you're stretching your sciatic nerve. So we're going to do this a little bit differently. Today, I want to press the belly button forward and up. And we just go as far forward as you can before you start to feel a bit of a stretch. Now, the foot and the head are going to move in the same direction at the same time. Okay, so it's going to look like this, where we just do. Let's actually do this like Janya Shirshasana. So we'll bring the left foot in to the heel, or the left heel in towards the inner right thigh, and the right foot is going to go forward as the head goes down. And then we lift the foot and the head at the same time. Now I'm not lifting the whole spine. I'm slouching forward, pointing the toe and tucking the chin, and then lifting the chin and lifting the foot. Point the toes and the ankle and tuck the chin, and then lift the toes and the ankle, lift the head. So here we are. We're going to do this 5 more times, nice and slowly. So this way, we do put a little bit of tension on that sciatic nerve, but we are flossing it, like grabbing two ends of a rope and pulling it back and forth through the entrapment sites of the piriformis, or maybe through the spine, through the foramen as it exits from the spine, if that nerve root is getting irritated, right? So no matter what, wherever that sciatic nerve is getting irritated, we are flossing that sciatic nerve back and forth through those tunnels. Okay, now let's do the other side. We're just doing both sides. So no matter which side you're experiencing your sciatica symptoms on, this is going to get it. So again, we sit up tall and then we lean forward a bit just until we start to feel a stretch. We kind of slouch through the spine, and then the foot and the head point at the same time, and then we come back up. Point the foot and the head, and up. We're going to do this about 10 times total. So try to breathe peacefully as we're doing this. Don't worry about the fact that we are rounding our spine. That is totally safe. We already rounded our spine, right? Remember in child's pose, we already rounded our spine. So it's okay to round your spine. We're not forcefully doing it. Again, head and foot, same direction, same time, kind of like windshield wipers. Foot and toes lift, head lifts. Foot and toes point down, chin tucks. You could even inhale as you look up. And then exhale as you look down. Let's do this 2 more times. And down. Last time. And down. Okay. Now, let's loosen up that piriformis here. So I want you to take your right foot and place it on top of your left knee. And this is a figure 4. This is kind of like a pigeon pose, and it's going to stretch your piriformis. Now I want you lifting your belly button up towards your shin if you need more of a stretch. I want you to find a fairly decent stretch here. Once you do, we're just going to relax here for about a minute. We're really just trying to relax the piriformis muscle and get it into a nice stretch. So sink into your breathing. Breathe in through the nose and out through the nose. Nice and slow. So again, that piriformis muscle is underneath your glutes, and the sciatic nerve goes right through there. And sometimes it can just be a little irritated by that piriformis muscle. Now, to get a better stretch and really get that muscle to relax, what I want you to do is press your right ankle into your left knee. So you're firing up that piriformis. We're pushing the right ankle into the left knee so you feel engagement in the glutes and the piriformis. So push it with about 30 to 40% of your maximum effort. So it should feel like you're working, but not too hard. And keep that for about 30 seconds total. We're just holding here, engaged. Keep pressing the foot in, or the ankle really, into the top of the left knee. Hold for another 10 seconds. Push a little bit harder for 5, 4, 3, 2, and 1. Okay, now we're going to take that lacrosse ball or tennis ball or massage ball, whatever you got. And I want you to just place that underneath that butt cheek. And we might just kind of lean partially onto the ball. You don't need to put your full weight on it. I just want you to find a place dead center of the butt cheek. And you can kind of search around slowly for some tender points. And then when you find a tender point, just relax right there. Just breathe. So really slow, deliberate breathing here. Now, you could, if you really can tolerate a lot, or if you have a softer ball, you can cross the foot back into that figure 4 position and hold this pressure point in the piriformis muscle. But this might be a lot of pressure for you. If it's so intense that you cannot relax or you cannot breathe peacefully, then it is too intense. It does not need to be excruciatingly painful. It's not going to be comfortable, but it doesn't need to be super painful. So we're just here, we're breathing for another 10 seconds or so. So we want to do this for a bare minimum of 30 seconds. Nice and easy. Breathing here. One more breath. And we can relax. Okay. Now you could spend more time here on your own. You could hunt around and find a couple of different spots, right? You might have a couple of tender points. You could spend 30 seconds per tender point if you wanted on your own. But we're going to switch to the other side. So I'm going to take my left foot on top of my right knee, find a stretch here, lift my belly towards my shin to get more of a stretch on that piriformis. And we're just going to relax here for about 30 seconds, followed by about 30 seconds of pressing the foot into the knee. So for now, just sink into your breathing. By the way, I did not mention this on the other side, but if this is too intense of a stretch, you could, of course, drop back down onto your elbows. Or if your elbows are getting tired, you could lay down and bring the foot towards you by grabbing the back of the right thigh. It's the same stretch, it's just less effort for your hands to hold you up. So I'm going to take this variation on this side just to demonstrate that you could do either variation. They are equally effective. So here we are. Now let's begin pushing the left ankle into the top of the right knee and fire up the left glutes. So you should feel engagement on the underside of the left butt cheek. So push that left ankle into the top of the right knee so you feel some engagement. About 30 to 40% of your maximum effort. So you're working, but you're not straining too hard. Again, really important to relax this piriformis muscle if it is the culprit, if it is the thing that is irritating your sciatic nerve. So now for about 10 seconds, we keep pushing. And then push a little bit harder for 5, 4, 3, 2, and 1. Okay. Now we're going to use that ball again and massage. So I'm going to sit up, find a spot underneath that glute, that left glute, and just work my way onto it. Kind of explore a little bit, and then see if I can find a tender point. Oop, there we go. That one's pretty tender. So you don't have to put your full weight on it. You can just relax right here and breathe. But if you want, you could cross the ankle back and put your full weight, or really sit on the ball, supporting yourself with your hands, and put some weight on it. Right? But if you put so much weight that you cannot breathe nice and peacefully, I like to exhale like I'm fogging a mirror. That's going to help to relax. Then you're doing too much. It shouldn't be excruciatingly painful. Don't force it. More pain is not better. Okay, more relaxation is better. So inhale and exhale. Continue to breathe as peacefully as you possibly can, so we can tap into that vagal response, get the nervous system to relax into that parasympathetic state. One more breath here. And exhale. Okay. I'm going to take the ball away. That is all we need to do. You could do that if you have sciatica and low back pain. You could do that every day. The ball, again, you can hunt around it for different spots. Really, you should spend more time doing these things on the side that you feel the symptoms, but doing both sides is going to be beneficial for you anyway. If you want more guided practices, I usually don't release these videos publicly on YouTube, so this is a rare occasion. But if you want more guided practices, check out my guided class library. It's part of my all access membership on the website. So go to the link, it's in the description. Check out the membership, check out the guided class library, where I have a lot more functional movement. If you have questions about low back pain or sciatica, I work with people remotely from all over the world to rehab their pain and injuries. I will write a program just for you so that you have something to bounce back as quickly as possible. Thank you for watching. Movement is medicine. Motion is lotion. So be sure to move your body every single day.